Before proceeding, subscribe, share and like my channel so that you didn't miss any notification regarding future uploads of my channel.
The mother of a 7 years old child is dying. The nurse anticipates the child will have which of the following concept of death. So its answer is first one, that is death is punishment for his or her action. As 7 years old child see death as a punishment. Options second, third and fourth are incorrect because by age of 9 most children begins to develop an adult concept of death and begins to understand that death is irreversible and inevitable. Death is temporary and gradual is a preschool child concept of death. Death as a concept based on past experience is an adolescent concept of death. A client with newly diagnosed type 1 diabetes says to the nurse, I know that I have to take good care of my feet. When I buy new shoes, is there anything special I should do? Which of the following response by the nurse is best? So answer is second. Have each foot measured every time you buy new shoes. As because feet enlarge with age, break in shoes gradually rather than all at one time. Have measurement for shoes taken while standing, because while standing up, feet expands under weight of the body. First is incorrect because it is best to buy new shoes in afternoon. Third is also incorrect because we should buy the correct shoe size. And fourth, leather shoes recommended because they breathe. They breathe here means they won't smell and it also prevents nasty odor. Vinyl could cause food to perspire and aggravate fungal infection. A neonate weighing 7 pound 4 ounce with Apgar score of 7 and 8 at 1 and 5 minutes respectively is admitted to the nursery. Because the infant's mother is diagnosed with a type 1 diabetes, the nurse knows that the infant is at greatest risk for developing which of the following? Answer second, hypoglycemia. Second is correct because fetus produces increased insulin to match mother increased glucose level during pregnancy. Infant continues to have high insulin output after birth, resulting in hypoglycemia. First is incorrect. Hypovolemia will not happen in child because there is no change in blood volume for infant of diabetic mother. Option third, hyperglycemia is incorrect because infant would be at risk of hypoglycemia due to increased insulin production. And fourth, cold stress is incorrect as thermoreceptors in skin are stimulated due to cold environment. Increased metabolic rate. Infant needs to maintain normal body temperature while producing minimum amount of heat generated from metabolic process, not expected with diabetic mother. The nurse in the outpatient clinic assists with the application of a cast to the left arm of a preschool age child. After the cast is applied, the nurse should take which of the following action? Answer second, elevate the client left arm on two pillow. So by elevating the client left arm on two pillow, it will minimize the swelling. And elevated for first 24 to 48 hours protect from pressure and flattening of cast. And first is incorrect because petling the edge of cast is done when cast is completely dry and that prevents crumbling of plaster into cast. And third is incorrect because applying cool humidified air would lead to delay of drying of cast. And fourth is incorrect because maintaining mobility of finger not important after application of cast. The nurse plans a diet for a child diagnosed with cystic fibrosis. Which of the following dietary requirements should be considered by the nurse? Answer second, high protein, low fat and high calories. Option second is correct because impaired intestinal absorption due to cystic fibrosis necessitates a diet higher in protein and calorie. Fat is decreased because it may interfere with absorption of other nutrients. Option first is incorrect because it contains high fat, and third is wrong as it is not adequate for this child, and option fourth is not correct because it contains high fat. A male client is admitted with urinary tract problem. A prostate specific antigen, that is PSA, and acid phosphatase test are to be done. The nurse knows that. Answer first, these tests are valuable screening tests for prostatic cancer. First is correct because PSA test, that is prostate specific antigen test, has replaced acid phosphatase test in screening for prostatic cancer. Test must be drawn before digital rectal exam as manipulation of the prostate will abnormally increase PSA value. Other options are incorrect because they give inaccurate information about PSA, that is prostate specific antigen. A client with clear lung sound and unlabored breathing receive aminophylline IV. Which of the following is the most appropriate nursing action if the client's IV infiltrates? Answer 4. Call the physician and recommend that the IV medication to be changed to PO. Fourth is correct because a new IV is started on this client. Physician should be called and PO medication recommended. And here PO stand for per os, that is by mouth. A client diagnosed with bipolar disorder is in manic phase with combative behavior. Which of the following is the initial priority nursing action? Answer 4. Administer and monitor sedatives and mood stabilizing medication. Fourth is correct as by administering sedatives and mood stabilizer medication, patient will be calmed down. And first is incorrect because providing adequate hygiene and nutrition are not initial priority. And second is incorrect because decreasing environmental stimulus is an additional strategy that when utilized in conjunction with psychopharmacologic intervention can reduce hyperactivity and aggressive acts. Just decreasing environmental stimulation will not diminish client's internal sense of agitation and aggression. And third one is not appropriate at this time. A client is admitted to the neurosurgery unit for the removal of a cerebral tumor. The nurse expects the patient to make which of the following statement about symptoms? Answer second. I lose my balance easily. Second is correct as cerebellum maintains balance. First is incorrect because temporal lobes contains auditory centers and loss of hearing would involve cranial nerve 8 acoustic, that is vestibulocochlear nerve. And third, cranial nerve 9 glossopharyngeal, responsible for differentiation of taste. And fourth is incorrect as it is not easy for me to remember names and faces are not specific symptoms of cerebral dysfunction. Nursing management prior to an intravenous pyelogram, that is IVP, would include which of the following? Answer third. Cleansing enemas the evening before to provide for adequate visualization of the urinary tract. Third is correct because of the need to visualize the abdominal area. Cleansing enema the evening before and intravenous pyelogram are usually ordered. First is incorrect as fat-free meal is associated with a gallbladder series. Second is incorrect as a retention Foley catheter may be in place but not for the purpose of dilating the bladder sphincter. Fourth is incorrect as there are few directions the client needs to follow during the test.
Subscribe my channel and hit notification bell icon so that you didn't miss any future uploads of my channel. Till then, see you soon.